Super. Welkom, wat leuk dat jullie er allemaal weer zijn. Deze, ik wou zeggen avond, want het lijkt al echt 8 uur 's avonds, maar het is pas 5 uur. Ehm, Wij gaan het vandaag hebben over combinatietherapieën. En we hebben weer onze fantastische gastspreker Deborah. Zij is Chief Scientific Officer van WICO. En zij zal jullie zo meteen verder gaan meenemen in het verhaal. Ehm, Wat we namelijk vandaag eigenlijk allemaal gaan bespreken, ehm, gaat zij zo meteen natuurlijk met jullie even kort doornemen. Ik zal het ook in het Nederlands doornemen. Het is allemaal in het Engels. Als je iets niet begrijpt of je hebt er vragen over, zet het gerust eventjes in de chat, want dan kunnen we daar op het einde even op terugkomen. Ook als je graag wil dat iets vertaald wordt, dan vraag het even in de chat. Dan kan ik het in het Nederlands eventueel voor je herhalen ook nog. Ehm, maar leuk dat jullie er in ieder geval allemaal zijn. Ik zie nog wat mensen binnendruppelen. Mijn naam is Lois. Ik ben de huidtherapeut en de clinical trainer bij Sure Medical. Velen van jullie zullen mij al wel kennen, sommigen ook al niet. Als jullie dus vragen hebben, stel het mij gerust. Ik zal daar ondertussen een beetje antwoord op geven. Of aan het einde, afhankelijk. Wat we vandaag voornamelijk gaan bespreken is PRX en de combinatietreatments voornamelijk. Dus hoe is PRX te combineren? In welke volgorde kunnen we deze behandeling optimaal inzetten? We zullen wat praktische tips en voorbeelden vanuit de praktijk. Deborah heeft hele mooie voor- en na-foto's die ze graag met jullie wil delen. We willen graag kijken hoe je natuurlijk slimmere combinaties beter kan inzetten. Zien nog wat mensen? Iedereen toelaten. Ja, top. Dus hoe je met slimmere combinaties betere resultaten kan behalen en wanneer je iets juist niet wil combineren. Er moet natuurlijk wel een meerwaarde zijn voor je combinatietechniek. Dus dat soort dingen zullen we vandaag allemaal met jullie gaan bespreken. Ehm, Graag eventjes je microfoon uit in verband met de ruis. Camera mag aan, hoeft dus niet. Weet wel dat er wordt opgenomen, dus je gezicht zal anders misschien in beeld komen. Die terugkijklink die zal doorgestuurd worden naar mensen die er vanavond niet bij konden zijn, bijvoorbeeld. Of ook naar jullie zelf als jullie het rustig een keertje terug willen kijken. Nou ja, vragen kunnen dus tijdens de presentatie gewoon gesteld worden en zal ik uiteindelijk met jullie behandelen. Jullie mogen die vragen, als je dat liever wil of fijner vindt, gewoon in het Nederlands stellen. En dan kan ik ze altijd vertalen, maar het mag ook direct in het Engels. Dat is allemaal geen probleem. Nou, dan geef ik het woord aan Deborah. Zij is de Chief Scientific Officer of WICO en zij gaat jullie alles vertellen over de PRX. Deborah, I will stop sharing my screen and you can start with your presentation. Thank you very much. Yes, you can.
Okay. Okay. Can you see it?
Not yet. I think it's just, yes, perfect.
Okay. Let me put you here so that they see you all. Okay. So good evening, everybody.
Can
First
you,
of all,
sorry, Deborah, can you put it in a big screen? Now we see the whole PowerPoint, not the presentation mode.
I have it in the big screen.
Mm, we see the whole, I don't know if the rest, but I see your whole, like not only your slides.
You don't see, you see just the small?
Yeah, we see like your whole screen, not just the slides. If you put it on
Okay,
like
you can do something.
on the right side below, you have to push the button presentation mode.
No, yes, I have it. I
Oh,
see the full presentation.
now it's
I see
great.
the
Yes.
full screen.
Now I see your presentation. Perfect.
Okay,
Yeah.
just a little bit slow, tiring.
No problem.
Okay, so let's start talking about our journey because we wanted to give this title, Beauty is a Journey. And of course, you are all familiar with a lot of treatment, and PRX family is part of the treatment you normally use in your practice. And so let's see how to combine PRX with other aesthetic treatments. Let's start by just refreshing a little bit our mind. A very important question. Can you see my slides moving?
Yes, yes, I see
Good.
the next slide.
And a very important question I think we have to ask ourselves is, what is beauty? I mean, beauty can be, of course, subjective or objective. But when it comes to objective beauty, it's a matter of proportions, of volume. But luckily now, aesthetic treatments are moving and are focusing more and more towards taking care about quality of the skin. So it's not just a matter of removing wrinkles, filling some areas, but we need to take care about the quality of the skin. From this Korean article, it's very nice to understand how it is described and how it is perceived, the perfect skin. So what do we have to see to have the perfect skin? The skin has to be tight, so we need elasticity, tightness, hydration. The surface has to be very smooth, so no wrinkles, no enlarged pores, no scars. The color has to be homogeneous, so no hyperpigmentation, no redness, nice color, basically. Cherry on top of the cake is the glowing, the radiance effect. Okay, this is considered the perfect skin. So for the perception of beauty, it's important not just the volume, not only proportions, but also the surface, the skin itself. The surface is very important, not only because it does give us the feeling of beauty, but also because we can interact through the surface with very deep layers. So even with a topical application, so with our PRX family members, we can interact with the dermis level and have a stimulation in terms of having more collagen fibers, more hyaluronic acid. So we have a family of skin booster, topical skin boosters. And this is possible because of the action mechanism we have talked about. Just keep in mind that when we apply these two formulations on the skin, what we have is absorption of the ingredient at the epidermis level. At the epidermis level, the ingredients are able to trigger biochemical events leading to the effect that we have at the dermis level. That's why we don't need to inject the product. Is the proper formula just to interact with the surface and to induce action mechanism reflecting at the dermis level. We have two different products, PRX T33 and PRX Plus, because we have two different formulations, because we need two different formulations for different indications. So just to keep it in mind, to refresh our memory, PRX T33 contains 33% trichloroacetic acid modulated by hydrogen peroxide with kojic acid that prevents post-inflammatory hyperpigmentation. Trichloroacetic acid is mainly tightening, so working at the dermis level. Hydrogen peroxide is modulating and also, let's say, healing the skin. When we move towards PRX plus, what we have is a salt of trichloroacetic acid, that is ammonium TCA. We have homocysteine acid that is stronger than TCA, that is able also to activate the ammonium TCA. And then we have citric and phytic acid. So keep in mind that when we talk about T33, we have TCA responsible for the tightening and lifting effect. The hydrogen peroxide is healing and antiseptic. It's important here to underline that it's antiseptic because, for instance, antiseptic and healing, when you have very sensitive skin with rosacea, with cuperose, or whenever you have acne with inflammation, you will always choose PRX T33 and not the plus. And so it's healing and antiseptic. And then we have the kojic acid, preventing post-inflammatory hyperpigmentation. We switch to our PRX plus, the newborn, and we have the ammonium TCA. Like TCA is responsible for the tightening effect, and we have homocysteine acid, mainly responsible for brightening, lightening, and smoothing. So concentrating on deep wrinkles and hyperpigmentation. Okay? Both the formulations, they both keep the same advantages. I mean, we apply them in the same way. It takes just 10 to 15 minutes to apply the product. No bruises, no downtime. For both of them, safe on all skin types. We are carrying on studies. I mean, we are, of course, more experienced with the T33, but I can guarantee we are doing studies now on the plus, on all the phototypes and all the word area that you can imagine. We are treating contemporary more than 200 patients, ranging from different weather conditions, skin condition, in order to give even more data. But keep in mind, both of them, fast treatment, no downtime, no bruises, no need for injection, ideal for all skin type, ideal under all weather condition. So these are the advantages belonging to both of them. Let's focus and keep in mind the indications of each product so that when it comes to having the patient on your clinic, you are able to choose which one is ideal for who. For instance, T33 is ideal if you want to tighten the skin, hydrate the skin, if you have fine lines, or if you have delicate skin. In any case, as I said, cuperose, rosacea, acne with inflammation, you always go for the T33. And whenever you want the glowing effect, because the glowing effect belongs to the hydrogen peroxide. Okay, so this sort of glassy skin that you have immediately after the T33, it's related to the presence of hydrogen peroxide that gives a mild edema on the skin. So that's why you see this sort of glassy skin immediately after. What if you have a patient with photoaging, deep wrinkles, or uneven skin tone and hyperpigmentation? Any kind of hyperpigmentation can be sunspot, can be melasma, or when you have enlarged pores, oily skin, then you have to choose PRX plus. So you will choose your PRX depending on the skin concern. If it's sagging, if it's delicate, if it's fine lines, you go for the T33. If you want the immediate glow, you go for the T33. If you have deep wrinkles, if you have hyperpigmentation, if you have enlarged pores and you need sort of resurface the skin, you go for the plus. What is the immediate effect that you have with the plus? It's not the glassy glowing effect, is an immediate brightening and smoothing effect. So what you see is that the skin is immediately lighter, okay? So now we can position on the cake that we have seen before. Each slice of the cake better suits with one of our PRX family member. I mean, when we need more elasticity, tightness, hydration, and glow, we use the T33. When we need to work also on surface, like smoothing deep wrinkles or lightening hyperpigmentation or anyway brightening, we go for the plus. Okay, so that's how we position the product. Since today we are talking about combined treatment, of course, with combined treatment, we need first, the first step is let's understand what is the skin concern of the customer and what does bother the customer more. So if I have, for instance, a person with sagging skin and melasma, normally the melasma is what really bothers the person. So what do I choose, T33 or plus? For sure, I choose the plus. I start with the plus, keeping in mind that both the product anyway are stimulating the production of collagen, okay? But I have to start with the product that gives to the patient the effect that they want. I mean, in order to eliminate faster the problem that bother them more. So let's start to understand PRX and combined treatments. First of all, we can, as you all know, we know that they are both very flexible, both the PRX T33 and the Plus. So you can use them in standalone or combined treatment. The steps are basically the same, okay? The treatment is basically the same. The difference that you have is the amount of product that you need during the session. I'm considering the standalone or the combination. Doesn't matter if you are combining or if it's a standalone. Take into consideration that for the T33 you need a little bit more product. For a full face 1.5 ml, face and neck 2 ml. For PRX Plus, full face is 1 ml, face and neck is 1.5 ml, okay? For the T33, we can space the sessions 7 days apart. For the Plus, we need to space the sessions at least 2 weeks apart. So we need to space them a little bit more. But what is the purpose of combining PRX family with other treatments? First of all, synergy, okay? And the synergy with the different techniques gives you faster results. So you need less sessions and most of the times you have a faster recovery time because, for instance, if you combine it with laser, IPL, or any kind of energy-based device, and we will see it, since you are also using the PRX family member, you basically can use the energy-based device with a lower fluence, a lower energy level, okay? And of course, we have a higher compliance of the patient. Why a higher compliance? Because the effect of the PRX is something that you can see immediately, is something that you can appreciate immediately. And in some cases, like with injectable, for instance, you also have less pain and less risk of bruising. So patient anyway, if you use PRX as a primer or as a combination, it does give you something more in terms of compliance of the patient. They are happier and there is less risk of side effect. Okay, so how to choose combination? First of all, skin concern. What is the skin concern? Okay, I'm concentrating on sagging skin. I'm concentrating on deep wrinkles or hyperpigmentation. First of all, I need to understand the face of the patient. Let's say I have hyperpigmentation or I have deep wrinkles. And then I select, depending on the skin concern, I select my PRX. For instance, if I see the aging of my face, I'm 50 years old, but I don't have really deep wrinkles, it's more folds and sagging. So what is the ideal product if my problem is mainly related to elasticity, sagging skin, and hydration? For sure, I go for the T33. If I have even a younger patient, but with more photoaging, I mean, my aging is more like chrono aging, because I don't really like the sun that much. But if I have a 40 years old woman with photoaging, so deeper wrinkles and slight hyperpigment, some spot on the skin, I start already thinking that I go for the plus. Okay, so the first step is skin concern, choice of the product. Then I divided all the possible techniques into 4 different families. Injectables. The general rule with injectable is that first you apply the PRX and then you inject in the same session. Microneedling. Microneedling, we have the so-called sandwich technique, application of PRX, then microneedling device, and 1 extra layer of microneedling. We are gonna going through all of them anyway. And then we have the family of non-ablative energy-based device, like radio frequency, like non-ablative laser, IPL, all these kind of devices. Ablative energy-based device, application of PRX and ablative energy-based device, we strongly recommend not to do it in the same session because it can be something too strong for the skin, especially if you have darker phototypes. I mean, it can be safe if you have a phototype 2, but we had side effects in some cases when practitioners wanted to try, for instance, microneedling, radiofrequency, and PRX in the same session with Fitzpatrick 4 or 5. They cannot stand it. They develop post-inflammatory hyperpigmentation. That's why the general rule, the guideline from the company is if you are using an energy-based device that is ablative, you have to do the sessions in 2 different sessions, 2 separate sessions. Let's start with injectables. the main advantage that you have when you combine in the same session PRX, T33 or plus with injectable is that since you are creating a mild edema on the skin, it's much easier to inject filler, skin booster, mesotherapy, doesn't matter what you're going to inject. So it's less pain for the patient, it's less risk of bruises, and the immediate result. Because if you are using mesotherapy, for instance, the result is not immediate. It's not something that the patient can see immediately. So you make them happy with the PRX, not only because they suffer less, but also because you have a synergy with what you are injecting, and you also have the immediate effect, the immediate satisfaction. So this is the general rule. If you want to combine in the same session PRX and injectables, cleansing with YCOP solution, apply the PRX with the traditional massage, and then inject the product that you need to inject, remove the residues with a wet pad, and then apply Wyco nourishing cream and moisturizing for dry skin. Okay, let's make some examples. So I'm gonna show you some before and after pictures, keeping in mind the indications of the product. Like for instance, if we have problems at eye contour level, let's see, I can have, for instance, eye contour with micro wrinkles, dehydration of the skin, lack of elasticity. So which PRX do I choose? I choose the T33 because you can treat upper and lower lid, okay? So that's important with both the product. If the problem is related to lack of elasticity, fine lines, hydration, is T33, and you might inject, for instance, polynucleotides, like in this case, before and after 2 sessions. But if the problem of the eye contour is dark circles, instead of the T33, we can use the plus, because dark circle are partially related to an accumulation of melanin, okay? So we will go for the PRX plus, and we can keep the polynucleotides that also help. Keep in mind that in all the cases that we are seeing, we are using the professional product in the clinic, so always P solution, PRX professional, let's say, Wyco nourishing cream. And at home, they are all using, in those cases, the specific product by Wyco. So if you remember, our eye contour serum takes care about the elasticity of the skin, okay? So wrinkles, elasticity, hydration, but also it takes care about dark circles and swollen eyes, okay? So it's very important if you want really to have a strong result to choose the proper home care, because it's really helping. I always say that when we went to school, I mean, we were attending lessons, but we were doing homework also, because otherwise you don't learn properly. Okay, so it's your job to give the lesson. It's their job to do the homework. Okay, So you will both be happier. Again, PRX and injectable, let's take into consideration full face and again take into consideration the indications of the two PRX. If our problem is the texture, of course, the texture problems belongs to PRX plus family. So we can combine PRX plus and mesotherapy. But if the problem is sagging skin, mainly sagging skin, and we need sort of also, we don't want to use filler, but we want to fill this skin with collagen fibers, hyaluronic acid. This is a combination PRX-T33 and skin booster. The skin booster is hyaluronic acid on this case. Okay, so you can see what we can have after 3 combined sessions. We can consider as injectables also threads that you normally use to lift the skin. So if the purpose of thread is lifting the skin, the selected product is immediately PRX-T33 normally, okay? So you can combine PRX-T33 and threads in case you want to help the tightening effect. Then here I see the effect after. If I look at the picture after, I see lines on the upper lip, I see wrinkles. What can I do? I mean, I can switch to the plus. It's not that if you start with one, you cannot keep going on with the other. I mean, you can have different skin conditions contemporary present on the skin. So you first give the priority to what really stress the patient. And then if you want to improve even more, you switch to a different protocol. Okay? Okay, this is just an example because this is not a combination, it's a standalone result that we had before and after 3 sessions with the plus. This is a Latino patient with a problem of pigmentation. Let's suppose we want to combine mesotherapy, can be for instance tranexamic acid. This is the ideal patient for a combination of PRX plus and mesotherapy, lightening mesotherapy like tranexamic acid. But the picture belongs to a before and after that is a standalone procedure with PRX plus. Okay, filler. Case of filler is just is not really synergic, is more what I told you in the beginning. Since you have a mild edema on the skin, it's easier to inject the filler. Keep in mind what I said from the beginning. I mean, it's not important for the perception of beauty, it's not important just the proportion, only the volumes, but the skin quality. So if we inject filler, it's important also to take care about the skin. I would say it's even more important, okay? Because if you feel too much and you don't take care about the skin, then the filler are gonna moving, okay? And the result is really unnatural, okay? So really tight the skin, take care about the skin quality so that you can even use less filler. The procedure is, as we have seen before, just cleanse, apply the PRX, inject the filler, and then rinse and apply the moisturizer. PRX and Botox. PRX and Botox, just one thing to say that we suggest not to do it in the same session. Because if you do First, the PRX, doesn't matter which one, and immediately after you do the injection of Botox, you might alterate the toxin. And if the patient received, if you do first the injection and then you apply the PRX, of course, you cannot apply it because you are spreading the toxin and you are altering the result. So let's say that you have to space Botox and PRX at least 2 days apart, okay? Before or after, doesn't matter when, okay? So let's change category and let's go to the microneedling, okay? And as I told you before, okay, here again, we choose the product depending on the skin concern. The advantage of combining PRX with microneedling, of course, is that we don't only have the chemical stimulation of our product, but we have the mechanical stimulation of the microneedling. And furthermore, creating microchannels, we have a higher absorption of PRX. So it's gonna working even more. So it's a real synergy, really increasing the effect. Okay. This is the procedure. So how do you have to proceed when you combine PRX and microneedling? Numbing cream. I don't know if you use it, I never use it. But if you use it, you have to start at the beginning applying the numbing cream. And my suggestion is if you need to apply the numbing cream, don't remove it completely before starting, but just remove half, work on half of the face and then remove the other half, because otherwise you're gonna losing the effect. Cleanse with the P solution, apply 2 layers of PRX, go with microneedling, and then apply a third layer of PRX. It's gonna burning a lot. And rinse, apply ice pack. The burning feeling, it's not gonna lasting long. It's a few minutes, it's just a few minutes. Here I have put for you a big warning, okay? Do not mix other products when you do this procedure, because I got a very bad picture. I don't remember from which area of the world. They did the procedure, but they mixed it with a mask before the treatment, a second mask after the treatment, different creams, and they had some, the outcome, everything is something that will be solved, but the recovery time will be longer. It's not what we normally expect when we do the microneedling. When we combine PRX and microneedling, what we expect is redness immediately after the treatment, recovery time few hours if you have redness and delicate skin, and normally, of course, since you do the microneedling, this is related to microneedling technique, the skin is drier the day after, so they have to apply a lot of cream, and you might experience a stronger exfoliation, a stronger flaking effect, but that's basically related to the microneedling. Okay. As a general rule, if you do a microneedling that is reaching the dermis, so let's say from 0.75 up, space the sessions 1 month apart. Okay, always, doesn't matter if it's T33 or plus. If you do this kind of procedure and you reach the dermis because the needle depth is higher than 0.75, space the session 1 month apart. You can do a standalone treatment in the middle, okay? If you are using a 0.25 just to increase the absorption of the product, you can reduce the gap in between 2 different sessions. Let's say you can do it even every 2 weeks. So let's see some before and after picture. What if I have post-acne scars, or you see these comedogenic acne with small pimples, but they are completely closed inside the skin? What do I have to choose, T33 or plus? Since we said that the plus is more resurfacing, is more smoothing, is ideal when you have a very thick stratum corneum. So I will combine the microneedling with the PRX Plus. So this is before and after 2 sessions. Here again, before and after 3 sessions, PRX Plus and microneedling. Here again, post-acne scars, but also a little bit, some pimples are still, let's say, active. Okay, here you can see that after 2 sessions with post-acne scars, PRX Plus is really helping a lot. So I would say that if you have post-acne scars to treat, you always need to choose and go for the plus, because it's stronger in terms of resurfacing, working on surface. Okay, these are some examples I personally did some years ago on sagging skin. And you can see that with the PRX T33 and microneedling. To be honest, at the time I didn't even have the PRX Plus. It was not available yet. But anyway, even if I have to do it now for this kind of patient, since what I see more is the sagging, I would like to improve the face contouring, I would focus on the T33. Okay, so that's what I did at the time. This is same condition. I worked with the most impressive part, in my opinion, is the neck, because the neck is very difficult to treat. And in that case, after 4 sessions, always spacing the session once a month. Okay, once a month, and the depth I normally use is 1 millimeter on cheeks and neck, and I use 0.25 on eye contour and forehead, because you don't need more. This case, sensitive skin, I mean, this would be perfect for the plus, because you have quite deep wrinkles, but anyway, you have to go for the T33 if you have sort of cuprose, rosacea. You better stick to the T33, because it's antiseptic, it's healing the skin, so just stay with the T33. This is another example, okay, like before. This is a before and after, just with the standalone treatment. But if you want to improve even more, just suppose, what if I combine it with microneedling? What would I have done? I would have combined, of course, the plus. This is a before and after 3 sessions with the plus, and microneedling with tranexamic acid, vitamin C, and of course, as a home care, whenever you have pigmentation, you need the lightening serum and the sunblock. This is compulsory. If you have cases like this one, we are talking about melasma, huge pigmentation. This was a this is also a Latino patient treated in Miami. She is a non-responsive patient. The doctor told me that he tried many different techniques on this patient, lasers and IPL, and that he finally could get some results with the plus. Okay, so if we want to improve a little bit more, even more and faster, just use the microneedling and also convey with the microneedling immediately after the treatment a little bit of tranexamic acid or vitamin C. So now let's move to non-ablative energy-based device. So non-ablative energy-based device, we can think about energy-based device releasing what I call bulk heat. So it's homogeneous. The heat, when you use the handpiece, is homogeneous, like radio frequency, microwave to tighten the skin. Or you can have focused heat, like HIFU, high intense focus ultrasound, that normally work on the deepest layer to lift the skin. And then we have the world of light, laser and IPL, non-ablative. Okay, let's see some example together. Melasma, PRX plus, of course, because it's a matter of pigmentation, and IPL. Here, very important, do I do it in the same session? No, this is a journey. What do I mean? When you have melasma, you have it's a problem of melanin, but you also have vascular problem. Melasma cannot be eradicated, you can keep it under control. The first step is taking care about pigmentation with PRX Plus. That is perfect, because when you deal with melasma, you cannot use aggressive techniques. Otherwise, you have a rebound effect and it's gonna becoming darker, okay? So you approach the melasma with techniques that are not aggressive, like PRX Plus. You get rid of the pigmentation, and then what you have left normally are very small vessels that you can close with the IPL. Okay, so that's the journey that you have to make in case you have melasma. This is a treatment of melasma with PRX Plus and a diode laser 675 nanometers before and after 3 sessions. In that case, you can combine the two techniques in the same session because this laser is less aggressive compared to the IPL. Non-ablative fractional laser. So non-ablative fractional laser, that means that it's gonna releasing only heat, not removing skin. And if we observe, we see that the eye contour, we have fine lines and a little bit of lack of elasticity. So skin concerns belonging to PRX-T33 before and after 3 sessions. Here again, we have abdomen area after pregnancy and skin laxity, basically. So we focus, the right product is the T33, and we can combine it with radio frequency in the same session. When you have heat, bulk heat, focus heat, or light, if you do it in the same session, is first you do the machine, the energy-based device, and then you do the chemical stimulation with the PRX family member. What about if you have ablative energy-based device, like a full field or fractional ablative laser, or microneedling radio frequency, or plasma, for instance? On that cases, I'm honest, I prefer to combine, not in the same session, as I told you before. You have to do your treatment, your PRX 1 or 2 weeks before the machine. And if I have to choose, I go for the T33 because it does speed up the healing process. Okay, so if you are planning a microneedling radiofrequency, treat the patient 1 week before with the T33 and then do the microneedling radiofrequency after 7 days. Okay, I prefer the T33 for the speeding up the healing. Okay. This is an example before and after 2 sessions. So concluding, identified skin concern. We made a lot of examples. Eye contour, its wrinkles or its dark circles. Choose your PRX. So it can be, I have sagging skin, so I go for the T33. I have pigmentation or deep wrinkles, and I go for the plus. Once I selected the PRX, I choose the synergy. It depends on what you have on your clinic. It depends on what is possible to combine and how fast you want the results, okay? And then finally, as I keep saying, do your homework. Because if your customer are not gonna doing their homework, the results will be late. You might have side effect like dry skin. So keep in mind that let's suppose you are treating sagging skin, okay? The ideal combination as a home care is the smoothing fluid and the nourishing cream for dry skin, okay? If it's a matter of pigmentation, you select the plus. You can combine it with microneedling, with Q-switched laser, with IPL. It depends on what you have. And you have to give them at home the lightening serum, the nourishing cream, because anyway, the pillar of the healthy skin is hydration. So they must all have a moisturizer, okay? So depending on the skin type, you can select the one for dry skin or the one for normal skin. Pigmentation, lightening serum, compulsory sunblock, okay? After you finish the cycle, we have other 2 wonderful specific products. One specific for aging, especially photo aging, the vitamin cream with retinoids and vitamin C. The other one specific for acne-prone skin, the balancing cream. We have before and after picture using just the home care with the balancing cream that are great. So I strongly recommend you to, to help your patient, to help your customer achieving the results they want as fast as they can, safely with the proper home care. Okay. And then thank you. And if you have any questions,
Thank you so much, Deborah, for your information again. Very clear. As well, the difference between the PRX and the PRX Plus is very clear. I think we have some questions in the chat. I see one. Does microneedling glide on the skin with PRX, or do you use the stamping method?
you can do both. I suggest you to first do the 2 layers anyway. And with the 3rd layer, you can glide, let's say, using the PRX uh, as a gliding gel, let's say. If you do the traditional is application, stamping, application. Because if you have dry skin, you cannot glide, you scratch. Okay. You can choose, they are both good.
Okay, and she has a follow-up question as well. Each layer is how many milliliters of fluids do you use?
If it's the T33,
Mhm.
if you're treating, let's say, the full face, no, I'm not considering the neck. If it's the full face, is 0.5 ml each layer.
Okay.
Okay, so it's 1 ml before the microneedling. You do the microneedling and 0.5 ml after.
Okay. Okay, great. And another question from Marianne. She is asking if it can be applied on the eyelids or under the eyelid.
You can apply it on both upper eyelid and lower eyelid. And also by doing this movement, you can lift the eyebrow.
Oké, je kan het dus inderdaad op het bewegend ooglid aanbrengen en ook onder de oogleden. En als je het dus omhoog masseert, dan krijg je een beetje een lifting van de wenkbrauw daarbij. Oké, I think that's it. Oh no. Do you use a neck fan during the application of the 3rd layer after microneedling? I think she means
The
for
fan.
cold,
It
yeah, a fan.
might be useful, definitely.
Okay, so you would advise using a fan for treatment.
Yeah. I mean, if it's really very fast because the 3rd layer, you don't need to massage the 3rd layer. It's just the application very fast, but a fan is always better.
Okay. Great. Let me see. Oh yeah. Someone just wants to understand it correctly. That she does the first layer of PRX and then microneedling with PRX and then again PRX.
No, it's 2 layers with massage, and then you keep, let's say, 0.5 ml, and with the 0.5 ml, you do the gliding if you want to do the gliding. If you do the stamping, is 1 ml stamping everywhere, and then 0.5 you spread it. Normally I put the drops and I simply spread it without pressing at all, and I rinse it.
Okay. Can you combine it with LED therapy?
Yes, definitely, both of them.
Okay. And would you advise to do it before treatment or after treatment, or it doesn't matter?
It depends on what you look for with the LED. Because if you are treating, normally the energy-based device is before, but if you have a wavelength that is healing, sort of healing, you can do it after.
Okay. Okay, thank you very much. Can you stop sharing your screen so I can do
Just
the...
one last thing. I
Oh,
just
great.
want to say that if you want to know something more, you can subscribe BYCO, that is our platform. Very useful because in this platform you can find different videos with different combined treatments, but you can find also a lot of marketing material, okay? Videos for the clinic, advertising for Instagram pages. So it's a very wide thing,
Great.
ranging from technically, scientifically, articles, before and after pictures that you can use
Mhm.
to something more marketing that you might need in the clinic.
Great, great. Good to know. I have another question. Someone asked again if you can use the PRX Plus and the normal T33 on the same time, like over each other, I think she means.
That's a quite common question. I
Mm.
mean, normally it's there's no contraindication. It's
Okay.
important to say there's no contraindication
Mm-hmm.
um, because the two formulas doesn't crash,
Mm-hmm.
okay? But normally there's no need to mix the two formulations because if you identify one skin concern, you first take care about the one that is bothering more. We launched the Plus last week in Greece,
Mm-hmm.
and I had the question, but what if I have melasma on the forehead and sagging skin on the cheeks? Can I do the T33 on the cheeks and the Plus on the forehead? Yes.
Oh, perfect. Good to know. Good to know. Thank you. Oké, nou jullie allemaal super bedankt ook voor jullie aandacht. Ik heb alleen nog een laatste mededeling. Ben je nou heel erg enthousiast geworden over PRX Plus? Wij lanceren namelijk een event. Dit doen wij op 24 november bij ons op kantoor in Kuik. Het is van 9:30 tot 13:30. Hierbij gaan we je alles vertellen over PRX Plus. We geven een leuke demo van de PRX Plus. We gaan hele interessante before- en after cases met jullie doornemen. Ook het marketingmateriaal wordt allemaal met jullie gedeeld. En het is gewoon een hele gezellige dag met een hapje en een drankje. Ook gezellig altijd om bij te kletsen als behandelaars natuurlijk en professionals onder elkaar. Je kan je via de QR-code kan je je direct aanmelden. Op het moment dat je hebt aangemeld, dan krijg je daar natuurlijk ook een bevestiging van ons. Maar dit is dus voor de PRX Plus. Werk jij, want wij hebben wel altijd een vereiste dat je dus al bekend bent met de PRX T33. Ben je dat nou nog niet? Geen enkel probleem. Als je dus nog geen PRX gebruiker bent, dan kun jij je alsnog aanmelden voor het lanceringsevent op maandag 24 november. Want in de middag hebben wij aansluitend een PRX Therapy training. Dit zal dan van 1:30 tot 5 uur zijn. Uiteraard verzorgen wij ook even een lunch in de tussentijd, dus dat jullie wat te eten hebben. En dan maken we er een hele informatieve en gezellige dag van. Dus in de ochtend zal het lanceringsevent van PRX Plus plaatsvinden. En in de middag is dan de mogelijkheid om gewoon de training van de basis PRX te volgen. Zodat je uiteindelijk kan starten met zowel de PRX T33 en de PRX Plus. Ehm, ja, ik krijg nog een vraag inderdaad over wanneer je het kan kopen. Nou, de PRX T33 die is al te koop, uiteraard al een hele tijd bij ons. De PRX Plus zal na het lanceringsevent op 24 november te koop zijn. En de presentatie krijgen jullie ook allemaal nog in de mail als terugkijklink. Ik zal hem even op de QR-code laten staan. Dan hebben jullie nog wat extra tijd om te scannen. I would like to thank Deborah for her time again. She did amazing in clearing everyone's questions. Thank you so much. I hope you have a great
Thank you
evening.
all.
They say thank you, thank you, thank you. Great. Thank you for the presentation. Thank you.
See
Great.
you. Bye
I hope to
bye.
see you soon and have a great evening, Deborah.
Thank, thank you
Dag
very much.
allemaal, fijne avond nog. En ik hoop dat ik jullie nou, de 24e op het lanceringsevent zie. Bye bye
Bye.
everyone.